Let me begin by commending the organizers of this function and ourselves as partners in observing the measures that we repeatedly remind Kenyans about. I'm impressed the way we're doing things here in terms of observing those measures. The chief guest, Cabinet Secretary, National Treasury and Planning, Ambassador Ukuri Yatani, the Cabinet Secretary of Public Services and Gender, Professor Margaret Kobia, my colleagues, Chief Administrative Secretaries present, the PS for Planning, Mr. Saitoti Torome, Director General NCPD, Mohammed Sheikh, UN Resident Coordinator, Sid Chatterjee, and Country Rep, UNFPA, Dr. Ademola Olajide. Ladies and gentlemen, good morning. It's an honor and indeed a pleasure to join you today during this 2020 World Population Day celebrations. On my behalf and on behalf of the Ministry of Health, we are marking this day even as the world continues to grapple with the challenge of the COVID-19 pandemic. Amidst this pandemic, this year's World Population Day theme focuses on safeguarding the right of women and girls in the face of challenges presented by the pandemic. The pandemic has exacerbated problems such as teenage pregnancies, gender-based violence, and other harmful practices faced by women and girls that will undoubtedly lead to poor maternal and child health outcomes. Teenage pregnancies, often driven by poverty, present serious health, social, economic, and educational challenges that deny already marginalized communities access to educational and employment opportunities. 26% of adolescents from poor backgrounds are more likely to get pregnant compared to 10% from wealthier households, according to the 2014 Kenya Demographic Health Survey. 33% of girls with no education are more likely to become pregnant as compared to 12% with secondary education. In some communities, adolescent girls are expected to marry and bear children early, further complicating the problem. Sexual and gender-based violence is another cause of adolescents' pregnancy. About a third of girls in some countries report that their first sexual encounter was coerced. Teenage pregnancies often present with medical complications. Adolescent mothers face higher risks of eclampsia, systemic infections, and puerperal endometritis than older women. Babies born to adolescent mothers face additional risks of low birth weight, preterm delivery, and severe neonatal conditions, as well as physical and cognitive challenges. Unsafe abortions further contribute to maternal morbidity and mortality in this age group. It has been reported that 17% of women seeking post-abortion care services are adolescents. Despite return-to-school policies to keep adolescent girls in school, school dropout rates due to adolescent pregnancies often remain high, jeopardizing future educational and employment opportunities for these girls. The Kenya Health Information System is a reliable database that captures data, among others, on adolescent pregnancies presenting in health facilities. In the period January to May 2020, Nairobi County is leading with 11,795 teenage pregnancies. This is slightly higher than last year's figures of 11,410 cases reported in the same period. Kakamega County is a close second with 6,686 cases compared to 8,109 cases last year. Machakos County, which has been the focus of the latest public outcry on teenage pregnancies, actually ranks number 14 with 3,966 cases registered compared to 4,710 cases for the same period last year. These numbers that I have given out here illustrate the need to be able to provide accurate data. What we saw in the media is not accurate data. When we go back to our databases, you can see that yes, the pandemic has disrupted many, many activities, has resulted in has created a lot of adversity in many areas. But when you look at the teenage pregnancies, our data show that while there may be some slight increases in the first quarter of this year compared to the past same quarter last year, it's not as alarming as the cases that were reported in the media. If we look at the total national numbers of teenage pregnancies reported for this period, that is January to May 2020, we are at 151,433, actually lower than what we saw during the same period last year at 175,488. Ladies and gentlemen, in conclusion, addressing the complex issues contributing to increasing numbers of teenage pregnancies in the country requires a multi-sectoral and multi-stakeholder approach that includes different line ministries, non-governmental organizations, civil society, and faith-based organizations. We need to engage communities, teachers, parents, and adolescents themselves as agents of change to end teenage pregnancy in the country. Thank you.